Admission or encounter for aftercare management. Aftercare visit codes Z42Z51 are used when the initial treatment of a disease has been completed, but the patient requires continued care during the healing or recovery phase or for long-term consequences of the disease. The aftercare code is not assigned when treatment is directed at a current acute disease. The diagnosis code is to be used in these cases. The exceptions to this rule are encounters for antineoplastic chemotherapy and immunotherapy Z51.1 or external beam radiotherapy Z51.0, when the encounter is for the purpose of more than one type of antineoplastic therapy, e.g., radiation and chemotherapy. Both codes are assigned and either can be sequenced first. Admission for aftercare management ordinarily involves planned care, such as the fitting and adjustment of an external prosthetic device Z44, attention to an artificial opening Z43, breast reconstruction following mastectomy Z42.1, or removal of an internal fixation device not related to an injury Z47.2. There are codes for encounters for attention to dressings, sutures, and drains Z48.0. There are also codes to report aftercare following surgery for neoplasm Z48.3, following organ transplant Z48.2, and following surgery on specific body systems Z48.810, Z48.817. These codes should be reported along with any other aftercare codes or other diagnosis codes to provide more detail regarding an aftercare visit. Palliative care is an alternative to aggressive treatment for patients who have a serious illness or are in the terminal phase of an illness. Care is focused on the management of pain and other symptoms of the disease, which is often more appropriate than aggressive care when a patient is dying of an incurable illness. Code Z51.5, Encounter for Palliative Care, is used to classify admissions or encounters for comfort care, end-of-life care, hospice care, and terminal care for terminally ill patients. It may be used in any health care setting. Palliative care is different from end-of-life hospice care, where the patient is not expected to live beyond 6 months. There is no unique ICD-10 CM code for encounter for hospice care. The Aftercare Z codes should not be used for aftercare of injuries. For aftercare of an injury, assign the acute injury code with the appropriate 7th character for subsequent encounter, e.g., D, G, K, or P, for fractures. Aftercare codes are generally listed first to explain the specific reason for the encounter. They can be used occasionally as additional codes when aftercare is provided during an encounter for treatment of an unrelated condition but no applicable diagnosis code is available, e.g., the closure of a colostomy during an admission to treat an injury sustained in an automobile accident. Aftercare codes should be used in conjunction with any other aftercare or diagnosis codes to provide better detail on the specifics of an aftercare visit, unless otherwise directed by the classification. The sequencing of multiple aftercare codes depends on the circumstances of the encounter. Certain Aftercare Z codes need a secondary diagnosis code to describe the resolving condition or sequelae. For others, the condition is included in the code title. When the patient is admitted because of a complication of previous care, the appropriate code from the main classification is assigned rather than the Aftercare Z code.